today to take your assessment. So I just came in for the next shift, so I need to do some assessments so I know what you need, okay? So anyway, I read some of your records. I will adjust your bed a little bit so we'll be more comfortable together. Okay? So anyway, I'm gonna wash my hands. So I'm just gonna do some assessment so we'll find out what do you need and what things I can do for you. So is that okay with you? So before I do that, can you tell me your name and your birthday? Okay, can I see your wrist? Okay, Bailey Easter. That's right. Okay, so you're the right patient. So if you don't mind, we're gonna start doing the assessment. All right, so do you want your head up or you want just lay down? Okay, I think that's a good idea. Let's do a little up your head so it will be easy for you and for me. Okay, so can you tell me, oh, I already checked and the patient is times 3 oriented. She knows where she is. She knows what she's doing here and she knows what day to day. Okay, so I'm going to start, if that's okay, I'm going to start to assess your head. So I will going to palpate your head, feel your head. Looks like there's no signs of intention or any problems. Looks good, and looking at you or talking to you, you respond really well. So that's I assess your hearing, and you're talking good. And can you look at me? Look at this light. Okay, good, good. And can you follow this pen? Okay, good. So looks like your Perla pupil is equal and reactive to light and accommodation. And then I will check your nose. Okay. Okay, nostrils look good. There's no signs of problems there. And can I see your mouth? Looks good. Okay, your face looks good. There's no uneven smile and droopy face. So everything looks good. So now I'm going to check your arm, your extremities. If that okay? Okay. I will feel your skin. Skin feels warm. Looks good. And I will feel your radial pulse. Perfect. You have +2 bilateral. And then I will check your cup refill. Perfect. Less than 3 seconds. Okay, so arms don't have any signs of edema, and I can see you have IV there, and I'll check your IV. Everything looks good. There's no signs of phlebitis or infiltration. Okay. So is that okay if I'll start to check your heart? Okay, that's good. Okay, so first I'm going to check your skin. I'm going to see your turgor. Skin looks good. And there's no problem. So now I'm going to listen your lungs. I mean your heart, to see the rate and rhythm, if you have problem or no. Okay, so I'll start listening to aortic, pulmonic, Erb's point, tricuspid, and mitral. So this is the point of maximal. So I'm going to listen for 1 full minute, okay? Okay, Esther, everything sounds good. You have 88 and it's normal. And there's no abnormal problems or distress that I listened. So, oh, I forget to ask you before I check. Are you having hard time breathing or no? No, okay, good. Okay, so now I'm going to check your lungs. So are you coughing or hard time breathing? Do you have problem for that? No? Okay, so I will going to check and I'm going to listen in front first, okay? Okay. Okay, sounds good. There's no signs of crackling or wheezing sound. So your lung sounds good and I should do that in the back too. I will palpate 8 times and same thing. You don't have problems with your respiration right now. Okay, so now I'm going to check your stomach. I'll check your vowel sounds, if that's okay. Okay, so looks like you have wound, so I will going to assess your wound. So wound looks dry and just barely changed and no problem, no drainage, and so I'm go ahead and listen to your vowel sound. Is that okay? Okay, great. So I will listen the 4 quadrant. Okay, I'm also gonna listen for some brewing. Okay, everything sounds good, and I should palpate. I should check you to palpate your stomach, but I'm not gonna do that because you just had your surgery, and you have wound there, so it will be uncomfortable. Okay, so good. Now I'm going to ask you before I check. How's your eating? Good? Okay. You can eat yet, huh? You're full liquid diet right now, good. But you've been drinking? Okay, that's good. You're drinking a lot. And then how's your your bowel movement? Oh, perfect. So you don't have problem for that? Okay, good. So your urine you can pee, or is that what you said? Okay. So we'll see what we can do to that, but I'm going to check your lower extremities, okay? Okay. Everything looks good. There's a little bit signs of edema because I think you don't pee today, or I'm going to listen to your pulse. Perfect. Okay, both pulse are bilateral, and I will check your cup refill too. Okay, good. So I think you're good. Can you tell me about your pain right now? Oh, 7. Oh, that's sounds like you're in pain. Okay, we're gonna do something about that. We're gonna help you. And anything else? Can you can tell me what anything else I can do for you? Okay, so looks like everything we talk about and we know what you need. So I'm going ahead and put you in your comfortable position. And then I'm gonna, because you told me your pain, I'm gonna use the Caldera for assessment too, which is characteristics, onset, location, duration, exacerbation, radiation, relief, and associated pain, associated signs and symptoms. Okay, so now we're good. I'm going to get ready and help you now that you're in good and comfortable position. And then I'm going to go and wash my hand. And then I'm gonna check what we can give you for your pain, okay? Looks like Esther have a order for a pain medication. I'm going to see and compare to the MAR, check for expiration date and the order. I'm going to calculate, so it says I need to give her 15, wait. It says 15 milligram. So the medication available is 15 milligram per 1 ml. Okay. So before I do that, I'm gonna confirm the patient's name. Okay. And can you tell me your name again, Esther? Okay. That's good. And then I'm gonna compare it to the MAR. Looks good. So now that ready, I'm going to confirm the 5 rights. It's to administer the medication, which is right patient, right drug, right dose, right route, and right time. Okay, so I did all my checks and I'm going to prepare the medication. So I did calculate that I need 1 ml because I'm using the 3 ml syringe. To do that, I'm going to put my gloves. And okay, so I'm going to prepare the medication 1 patient at a time. And so I'm giving her 1 ml. So I will get the syringe ready. And then there's not enough. It's not coming out. Okay, I got 1 ml and I'm going to 1 hand scoop, and then I will get ready, and then I'm going to prepare the site or find the site where I'm gonna do it or put it. So it looks like that's the position she really liked. Okay, so I'm going to clean the area where's we pick the side, the deltoid side. Okay, so now before I will administer, I need to confirm again if this is the right dose and right patient. Okay, so now I'm ready. Okay, I'm going to do like 90 degrees and I will what do you call that, help the skin and put it. Then I'm going to administer the medication slowly and then pull it straight how I give it. Then throw it away. And then I need to put some gauze and just don't massage it, just hold it a little bit until, or put a band-aid. Okay, so we're good. So then after I administer the medication, I come back in a little bit and see the result of the medication. And before I give the medication, also she knows that the medication is for her pain, and we already talked about the signs and symptoms also, or the adverse effect of the medication. Okay, so okay, Esther, now that you have your pain medication, we're gonna wait for maybe 30 minutes to 1 hour, and let's do your catheter, okay? So it will relieve your pain in there and your retention problem. Okay, so I'm going to clean my hands and position the patient, comfortable position, and I already given the medication. Okay, so now I'm going to perform the catheter. So okay, Esther, so after 1 hour I come back, I assess the pain. So now she is feeling good and she's ready for catheter. Okay, so I got your order and I'm the one who will put the catheter, if that's okay with you. Okay, so now can you confirm, can you tell me again your name and your age? Okay, or birthday. Okay, so can I scan your name again? Perfect, and you have that catheter order. So I'm going to get ready everything and I'll be back. So you're in the position, I'm here, and I'll get ready all the things I need to put your catheter. So this will be okay, so I'm going to put you in good position or comfortable position. Good. Okay, I think that's perfect. Okay, so Esther, we confirmed the order, so I'm gonna put it on to help you with your problem. Okay, what I'm gonna do is I'm going to provide you a perineal care. Okay. So okay, I'm just going to expose the area that I need. So I'll put you in comfortable position. Good. Okay, so, okay. Now I'm going to start cleaning your perineal area, starting in the farther, and then to my closest area, and then I'm going to clean the middle in one stroke. Okay, so now you're clean, and I'm get ready your stuff to do the sterile fill to give your. So I'm going to wash my hand. I'm going to open the catheter. So I'll save this. So throw the garbage there. Okay. Now I'm going to get my sterile gloves. Okay, and I'm going to start with my dominant hand. Okay, and then I'm going to start this holding inside. I have a hard time to put this on. I don't touch the inside, so that's good. Now I'm going to fix this because my hand is wet, I think. Ah. Okay, so I ripped my gloves, so I will take that off and I will pretend that this is sterile, okay? Is that okay?
Yeah, I think so.
Because, anyway, so I'm gonna hold the inside. Yeah, because it's got ripped and I don't have available. Is there one there?
Let me see if I have anything.
I think my hand is wet, so. Oh, is that sterile?
Yeah.
Okay.
Those.
I'll do it. Did you close it? No? It's
No,
okay.
no, you're good. Keep going.
This is nice, it's thicker. Okay, now I'm going to use my sterile gloves. And I'm going to start with my dominant hand. This is so small. You don't have bigger? Okay, it will work.
You'll be good.
Oh. Okay, good. Perfect. Now I'm sterile. I'm going to get start this. Aha! Okay, so it's not contaminated because it's outside. And I'm going to put the drape. Okay, I don't touch anything, so perfect. And now I'm going to prepare my stuff. I'm going to open the swab, put it in here, and I'm going to open and lubricate. Catheter. Okay, so I'm going to lubricate around 2 to 3 inches. Okay, then I'll get it ready. And I'm going to hook the syringe. Okay, it's ready. So now I'm going to transfer this to the area where closer to the patient. Okay, so now I'm going to use my non-dominant hand to open the labia and start cleaning. Start in the far end, 1 stroke, dispose. The same on the other side, and then I'm going to clean the middle. Okay, so now it's all clean, and now I'm ready to insert the catheter, and I'm going to instruct the patient that I will let her know that I'm ready to insert the catheter, and that my gloves is she can Esther, you can take a deep breath, and I start pushing the catheter until I see pee, urine coming out. It looks like it's coming out, and I will put 2 to 3 more inches. Okay, looks good. And then I'm going to flush 5 ml according to this catheter order. Okay, good. Now I can discard that, and I'm gonna pull until I feel some resistance. Good. So now we're in perfect position, and I should collect sample urine when it's needed, and I'm gonna use this. And now we're not sterile, so I'm going to clean up the mess if there's a mess there, and going to take off my gloves, clean my hands, and apply, put another gloves. Where's the secure thing? clean up, I put another gloves and I will secure the tube in her leg, and I should have to put a secure thing here, which I don't have. And then I'm going to put the bag under the bed. Make sure you don't put in the rail, you put under the bed where it's not moving, and it's under the under her hips. Okay, so now it's all good. And do you have any question? I will put the patient to comfortable position, clean up the mess, and assist the patient how the procedure goes if she's any question. And then I'm going to put the patient in comfortable position, lower the bed, and then I'm all done. Wash my hands and record.